Mr. Kustoff, you're recognized.
Thank you, Mr. Chairman. Thank you for holding today's hearing, and thank you to the witnesses. Mr. Zengilowski, close enough, fair enough?
Close enough.
First of all, thank you for your testimony about my bill. I think your testimony's been brilliant all day, so thank you. If I could follow up on that bill, so the bill is the Rural Patient Monitoring Access Act. To your point, it's H.R. 3108. It is bipartisan. I can say it as a member of Congress, but if you could, in practical terms, can you talk about why the legislation is important and necessary?
I sure can, and it's not complicated. CMS adjusts reimbursement rates for the same services based on geographies. And so rural districts tend to receive fewer dollars for the same services from Medicare and Medicaid than, for example, a practitioner in San Francisco who may be paid 30 or 40% more than a practitioner in rural Nevada. In this case, the services that we provide, remote patient monitoring services, cost approximately the same wherever we deliver them. I mentioned before, we employ approximately 150 nurses, and they live in approximately 35 different states. We don't employ them in very high cost of living areas generally, and we provide the same technology to patients whether they're in New York City or whether they're in rural West Texas.
So if you're a physician in New York City, is it fair to say that he or she may be dissuaded from treating a patient in rural Idaho versus New York or San Francisco or Chicago?
I would say the issue is probably bigger than that. If you're a physician in rural Iowa or, like I said, West Texas, you're facing a decision right now of, do I even consider offering remote patient monitoring to my patients or not? Because where the adjusted rate is so low, it's a no margin service for independently owned and operated physicians. And so they're faced with a very difficult decision. Those practices cannot afford to subsidize health care for their patients. And so they're really fighting a difficult situation.
So you would encourage Republican and Democrat members to support this legislation?
Wholeheartedly.
Thank you very much. I appreciate your response.